Namaste, my dear friends. Welcome to my educational channel. So today onwards, officially I am going to post the educational video based on the syllabus of Pharm program, Pharm Regulation 2008, which is based on the syllabus by Pharmacy Council of India. So in this educational session, I am going to cover different courses, that is subjects. So let me start with the clinical toxicology subject of Pharm 4th year. So this subject basically deals with the toxicology part. As I can see, there are a lot of recommendations from my students also कि there are so much of confusion in the clinical toxicology subjects. So let's learn together about these subjects. Slowly we are going to discuss each and every clinical aspects of this particular topic. So before going to the course and content, I just want to show you the syllabus by Pharmacy Council of India. So the syllabus is like as it is displayed in your screen. You can see that in this syllabus our first chapter is general principle involved in the management of poisoning. So where we will see the basic principle ki how we can manage the poisoning person or a person who is poisoned. That may be intentional, that may be accidental, or it may be homicidal sometime. So once he or she appears in our hospital, either in emergency department or once he is stable, so how we are going to manage that, all these things we are going to discuss in this particular chapter. Similarly, our second chapter is based on antidotes and its clinical application, where we will be seeing the different types of antidotes, how many types of antidotes are there, how these antidotes are going to work, and how they are going to nullify the effect of different types of poisons. That things we are going to discuss in this particular chapter. Similarly, our third chapter will be the supportive care in clinical toxicology, and this is one of the most important topic in our entire syllabus. Why means in the supportive care there are a lot of conditions, health conditions that needs to be evaluated, that needs to be stabilized, and that needs to be managed. So here what I want to say means we don't have antidotes for each and every poison. Sadly, we are having antidotes for less than 15-20% of poisons, so which is quite less. So in such cases, the supportive care, supportive management plays an important role. So this particular topic will be of utmost focus. Then followed by we are going to discuss about the gut decontamination. So gut is nothing but the intestine. How we can decontaminate the intestine means once the poison reached our intestine, generally after ingestion, then how we are going to remove the poison so that we will get the minimum clinical effect from that poison or toxins. So those things we are going to discuss in gut decontamination procedure. Then in fifth chapter we are going to discuss about elimination enhancement. Elimination enhancement is something like once the toxins or the toxic compounds or the poisons, they are absorbed in our systemic circulation and they reach to our systemic circulation, then how we are going to eliminate them from our body. So this particular chapter will be focused on that. Then in the sixth chapter we are going to discuss about the toxicokinetics. In the toxicokinetics we are going to deal about various toxicokinetic parameters. We might have studied in our Pharm, if we have studied Pharm, or if we are Pharm D student, then we might have studied about pharmacokinetic in the pharmaceutical formulation and similarly in biopharmaceuticals. Then here what we are going to discuss means how the poisonous compound, that is toxins, they are going to absorb in our body, how they are going to reach their concentration, then how our body is going to metabolize them, where these poisons are getting distributed, and ultimately which organs are involved in its excretion and elimination. Those all portions we are going to discuss in the toxicokinetics, and from exam point of view also this is again important topic from where we can expect some 5 or 10 marks question. And here what I want to again say that when we will be discussing about the general principle involved in the management of poisoning, under that only these antidotes and clinical application, supportive care in clinical toxicology, gut decontamination, elimination enhancement. So these 4 chapters, chapter 2, 3, 4, 5, these are going to well covered in chapter 1, that is general principle. So general principle involved in management of poisoning is the most important topic for us. So once we are very clear on that topic, then understanding and managing the poisoning condition will become comparatively easy. So we are going to spend some more time basically in the chapter 1. Then similarly in chapter 7, we have to discuss about the clinical symptoms and management of acute poisoning with some of the compounds which are listed below. So simply what we can say is there are several types of poisoning. We can classify them into the acute effect, then subacute effect, chronic effect and all. But in textbook we can see there are acute and chronic toxicity, but what our syllabus says means we have to focus more in the acute poisoning, and what are the clinical features of this acute poisoning, and some clinical aspects we are going to discuss here, and how we are going to manage them. So in the management of toxins and the poison substances, what we have to understand means we don't have the typical antidotes for all the compounds. That's why supportive measurement, some elimination enhancement technique and gut decontamination, these techniques becomes very vital, because we don't have much modalities to intervene and to get the favorable outcomes, because in the toxicity cases, as the concentration or the poison substance are rapidly deteriorating our health issues, we need to take the prompt action. If we are not able to do that, then we may have to have some consequences relating to that. So in this particular thing, first in the section A, we are going to see about the pesticide poisoning. Pesticide, we all are aware of pesticide. These pesticides are used to cure the pest, including insects, fungus, all those things. So in that also we are going to discuss about organophosphorus compound, the compound which are having the phosphorus on them. Then similarly the carbamates, organochlorines and pyrethroids. We are having 2-3 more compounds in the pesticide category. However, our syllabus is focused in only 4 compounds, 4 categories of compound, like organophosphorus compounds, carbamates, organochlorines and pyrethroid. Similarly, in the B sections, we are going to discuss about opiate overdose. We might have heard about opiate, and what are the clinical features of this opiate, and how we are going to manage that, how we are going to diagnose, and being a clinical pharmacist, being a future clinical pharmacist, what is our role, we are going to discuss in this section. However, I want to clear here that opiate overdose we are going to study from the acute perspective in this particular section. Then chronic effect we are going to discuss in the last chapter, that is in the chapter of substance abuse. So we are going to break the opiate overdose into 2 sections. For acute we are going to discuss here in chapter 7, and for chronic we are going to discuss in the chapter 13. Then another category is antidepressant, right? We might have heard about that, how antidepressants are widely prescribed, to counter the depressive symptoms, that is the major affective disorders nowadays, and its prevalence is again rising. And antidepressants people are not so mentally healthy also, and sometimes they will get frustrated, and sometimes the poisoning will be deliberate, or sometimes it may be accidental also, especially in the case of children and all. If the medication is kept at home and children are playing and they will consume, means at that condition also there will be a poisoning, some chances are there. So that particular thing we are going to discuss in the C of chapter 7. Then similarly chapter 7 section D we will be dealing about barbiturates and benzodiazepines. So barbiturates, one of the most widely prescribed drug. Benzodiazepines, rather they are very safe drug. They are having large therapeutic window. However, their excessive exposure or sudden ingestion of large volume of these drugs will lead to the poison toxicity. So we are going to discuss what are the clinical features and how we are going to manage them. Similarly, our E section will deal about the alcohol. In alcohol, Basically we are going to deal about ethanol, ethanol having low fatality, but high prevalence. However, methanol is having low prevalence, but the fatality and the toxic effects are high. Then we are going to discuss about the clinical features and management of these alcohols. Similarly, F section will deal about paracetamol and salicylate. We all know, right? Paracetamol, being a pharmacist, this is our, first drug, first ladder, first steps in our pharmacy field is paracetamol. So sometimes this paracetamol may also lead to the toxicity. Similarly, salicylate, famous example of salicylate is aspirin. We might have heard about that. Then another section we are going to deal about the toxicity of NSAID, that is non-steroidal anti-inflammatory drug. We all might have heard about the NSAIDs. So those things we are going to discuss here. Similarly, the hydrocarbons, where these compounds which contain the carbon and hydrogen in them. So we are going to discuss them. Some common examples are petroleum product and polyethylene glycol. We are going to discuss that also. Then similarly, others are caustic. In caustic, we are going to discuss about inorganic acids and alkali, how they are, injuring us, those things. Then in the J sections, we are going to discuss about, radiation poisoning, how radiation poisoning is hampering us. All those things we are going to discuss here. Then in section 8, we are going to see the chronic poisoning. Now up to upside we are discussing about acute poisoning. Now here onwards we will be discussing about chronic poisoning. So here acute symptoms we are going to omit here, and in chronic poisoning we are going to discuss here. Then basically we will be discussing the chronic effect of heavy metals. So heavy metal means which are having large molecular weight. No, it's not exactly the large molecular weight, yes, but they are very heavy in nature, right? And some of these compounds including arsenic, lead, mercury, iron, copper, which are majorly found in the consumables what we are consuming day by day, from drinking water, some herbs, some plants, and so on, and some packaged food, some pharmaceutical products also contain these heavy metal. However, there are strict regulation from the government. These limits of heavy metal should be in the permissible range, but sometime it may lead to the toxicity. In detail, we are going to discuss about these heavy metals in chapter 8. That will be again the topic of our interest, and this is also very, very important from our exam point of view. Then in chapter 9, we are going to discuss about the venomous snake bites. We all are familiar with the snake bites, and these are very common in country like India. We are going to see the various families of venomous snakes, and once the snake has done its job, once there is a patient of a snake bite, what are the clinical effects pertaining to this venom? There are various natures of venom, hematotoxic, neurotoxic and all. So how they are going to present their clinical influence in the clinical setup, that things we are going to discuss, and how we can manage that at the site of bite, or until the hospital help is reached. So that we are going to discuss in the first aid sections. Then we are going to see the complication of the snake bite injury also, and how we have to manage it. Again, those things we are going to discuss here. Then similarly, in chapter 10, we are going to discuss about the plant poisoning, especially the mushrooms and mycotoxins. We have already heard so many times, some people, especially in the remote areas, village areas, they are hunting the mushrooms in the wild nature, and sometime consuming those mushrooms will be harmful. However, now the mushroom farming is, now it has been civilized. Now this mushroom farming is a commercial farming now in the market, in the supermarket or in the vegetable market. We are getting these mushrooms now in the commercial way, which are already identified, and the species is non-toxic. However, if we are consuming them from the wild sources, we are prone to get the toxicity. Those things we are going to discuss in the plant poisoning. Similarly, in the food poisoning, different types of food poisoning, how these food poisonings going to show their clinical manifestations. So all those things and how we can manage them, and especially we will focus on the education, awareness and the prevention strategies of food poisoning. Then similarly, in chapter 12, we are going to discuss about the envenomations. Envenomations means कि whenever there are some insects like scorpion, ant, hornet, bee, and so on, when these insects bite or they sting, what happen, what type of symptoms will be there, all those things we are going to discuss here. Then in the chapter 13, we can keep it as a chapter 13, we are going to discuss about the substance abuse. Substance use is one thing, abuse is another thing. If we are using it in a wrong way, then we can say it's abuse. So what are the sign and symptom of these drug abuse, and how we are going to treat these conditions, and how we are going to reduce the dependency of an individual among these illicit substances. Those things we are going to discuss here. In that, our first category, we will be discussing about CNS stimulant, which will increase the CNS effect. Those we are going to discuss here. And here the major example is amphetamine. Once it was known as a Shaktiman drug, which people used to abuse it for making them wakeful during the night time, especially the truck drivers, military persons, and the persons who are working with the machineries in the industry and all. They used to abuse it in a routine fashion. Those things we are going to discuss here. Then opioid, and we have discussed opioid overdose in the acute poisoning in chapter 7. Similarly, we are going to discuss about the dependency of opioid, that is the chronic effects. Those things we are going to discuss in this chapter. Then CNS depressant, various agents like CNS depressants, which are going to depress the CNS, including the pharmaceutical products and natural products, which are generally abused. So those things we are going to discuss here. And in the D sections, we are going to discuss about the hallucinogens like LSD. These hallucinogens, they are potent psychotropic agent, and they will exert their action in the central nervous system, and they will actually disrupt the quality of life. All those things we are going to discuss here. Then in E, we are discussing about cannabis. Cannabis, you might have heard, in Hindi we will say it as a ganja. So all those cannabis things we are going to discuss here. How these things will show the sign and symptoms, how we will get dependency, and how we can manage it, and how we can prevent the relapse. All those things we are going to discuss here. And then our last sections, we will be discussing about the tobacco. We all know there are harmful effects of tobacco. Those things also we are going to discuss in the tobacco poisoning. Now government is running campaign during movie theater, in the public places. Now this tobacco smoking or chewing of tobacco is banned in India. All those things we are going to discuss in the tobacco section. So basically, I will be referring 2-3 standard textbooks for that. My first preference textbook is handbook of. What I want to say is this is very interesting topic, yet so many people will get difficulty in understanding the toxicology. But once we will go into the topic, we will make it very relatable, very understandable, exam friendly. So all those things, we will try to do it. And here. Now I'll just summarize, just revise all these aspects. Basically the chapter 1, which already I explained that this will include the chapter 2, chapter 3, chapter 4 and chapter 5. These 4 are the subcontinent of chapter 1 only basically. So this is of utmost important from exam point of view also. So much 2 marks question, 5 marks question and 10 marks question will arise here. Then toxicology, basically it is important for 5 to 10 marks question, which is again important from exam point of view. Then another potential 10 marks question or 5 mark question, or basically we can expect some case studies also from the section A, that is the pesticide poisoning. Similarly, all these poisoning are also important, like opiate overdose, antidepressant, barbiturates, alcohol, paracetamol and SAIDs, and all these things we are going to discuss one by one. Similarly, heavy metals also, they are very important for 5 and 10 marks point of view for exam purpose. If possible, I will try to share some question banks with you of different university, and we can take some sample questions, and we will see how to attempt that, and how to carry out with the clinical cases and all those things we are going to discuss here. Then in plant poisoning and all, these are less likely topics, but very important to understand. Once we are going to the rural part of India or any other rural places, so this will be of utmost important. and we will be seeing all these things, from clinical pharmacist point of view, and so that we can establish the relation of clinical toxicology with our course, so that it will be easy for us to work during the hospital. And so with this, this will be our discussion on syllabus. So basically, this particular topic, what I can say, as it is a clinically oriented topic, this is a very important topic, and I think very interesting also. And if we are learning it with our by heart, then I think we can score very nice marks also, right? So that those all things, we need to keep it in our mind, and let's work out together. So now, without taking much time, I'll just explain the basic concepts in the today's class. That is the basic concept of clinical toxicology. Then we will end the first class. Then in the second class onwards, we will enter into the syllabus, right? So now here we can see in the clinical toxicology, there are some basic concept and definition. We will try to understand it today. Once these concepts are clear from our side, then tomorrow onwards we can start our syllabus, and we will learn the things. Now here, first we need to understand what are the basic concepts and definition which are very important from clinical toxicology point of view. And sometime we may expect this particular terminologies or the concepts for 1 mark or 2 mark in our examination also. So our today's first terminology is toxins. So these are the naturally occurring poisonous substances which are generally produced by the living organisms, right? Living organisms, which means animals, plants, bacteria, these animals are having tendency, they will release, some substances either for their defense or to attack, their prey, or to protect themselves. For any reason, they will produce, these substances which are known as toxins. Then similarly, our second concept is the toxicity. This toxicity, how we can define it? This toxicity, we have to understand one important terminology, that is inherent. Right? This inherent means the ever growing or ever descending feature. It is an inherent capacity of a substance to produce the harmful or adverse effect. When we are taking any substance, or let's say it in another word, once the substance reaches in our systemic body or systemic circulation, or not only human, of any other living organism also, beyond the normal dose, there are some safety dose. If it is exposed beyond the normal dose, or in the larger dose for a certain period of time, again the exposure, the dose is influenced by the route also, which route it is going in our body. So that will say how toxic this substance is. Now here what we need to understand means, toxicity, it's in a simple way. How I will try to explain it means, when any poisonous substance, it will, go inside the body of any animals or human being or any other living creature, it will produce, some harmful or unwanted effect. That is actually not required. So that effect is known as toxicity. And this toxicity is largely dependent on dose, the higher dose. Normal dose will sometime give the pharmacological effect, but if the dose is too large, that's why I have kept here 2 arrows, then it will lead to the toxicity. The other parameter which will affect the toxicity is the duration. If the contact period is high, then the toxicity is going to be more, right? So these 2 parameters we need to keep it in our mind. Then our third terminology is the toxicology. So what is this toxicology? This toxicology is a scientific domain, that studies the adverse effect of chemical, physical or biological agent in the living organism. Let's say human, any other animals. It deals with the mechanism which we are going to discuss in all the toxicity related compounds in the upcoming syllabus. So basically we are going to deal about the diagnosis mechanism, how it is going to induce the harmful effect, then how we can diagnose it clinically in a relevant manner, and how we can manage these conditions, how we can intervene so that we can manage the toxicological conditions, and how we are going to prevent the further exposure or re-exposure to these toxicological substances, right? So this is a basic toxicology. Now let's come to the clinical toxicology. So in the clinical toxicology, it is a branch of toxicology, which concerned with. So this is with. So here onwards in my lecture, I will be using this particular symbol, one line above C, that is called with. This is a diagnosis. This triangle, it says diagnosis, and RX we are going to discuss about management. Okay. So which deals with diagnosis and management, and how to prevent the poisoning or toxic, exposure in the humans, with special emphasis on. Now I will just highlight what is important for learning and exam point of view. We are going to see the clinical features, the mechanism involved or the mechanism of action of these toxins, and the therapeutic intervention. So all toxins we are at least going to discuss these three parameters, how this toxic is affecting, what are the harmful effects, that is mechanism, then what are the clinical features it is going to show, and how we can manage it, that is how we can intervene it, right? Then it may be of drug exposure, drug overdose, chemical or industrial exposure, or overdose during our walk and all those things. Then some bites, envenomations, stings, all those things we have already discussed in our syllabus. Those things we are going to discuss. So clinical toxicology is nothing but we are discussing about human. So whenever there is a clinical term, clinical means human. That thing we have to understand. So whenever here onwards we will hear the term clinical, it means among the human. This is very, very important. You have to keep it in our mind, right? Then this definition is again important for 2 marks, right? This is important for 2 marks. You please make a note of it. Anyway, once our lecture will get over, I am going to provide you the note, very customized, very specialized note, probably in the description of the video section, or sometime I will be providing it through the Telegram channel. I am soon opening the Telegram channel where you can get all of these notes, what I am preparing and we are discussing in the class. Then similarly, another important section for exam point of view, that is for 2 marks. So here is the toxicity rating. Again, this is very, very important from exam point of view. So all of you should remember this. All of you should know it. This concept is very, very useful in upcoming topics. That is toxicity rating. There are several methods of rating toxicity. The most common and the most reliable method, which makes sense, which is clinically correlated, that is toxicity rating. How we can rate this toxicity means, one way we are going to see what is the usual fatal dose. Fatal is a term कि आदमी मर जाएगा, dead, कि आदमी कब मरता है, उसको हम बोलते हैं fatality. So when we are discussing about usual fatality dose, it derives from the concept of LD50. LD50 मतलब कि जैसे ये यूजुअल फेटाल डोज है, यहाँ पे मैं एक एग्जांपल देके बता रहा हूँ. वी विल टेक वन एग्जांपल. These are the super toxic food, and here there is a rating right from 1 to 6. The more rating, the more poisonous the substance is. So if there is a 6 rating, then this is super toxic. Super toxic means toxic से भी ऊपर, extremely toxic. उसके बाद आता है super toxic. Super toxic. What does it means? If any compound is taken in our body at the dose of less than 5 mg per kg. Let's assume an example. I am now 75 kg, right? If I will take any compound that is less than 350 mg, because I am 70 kg, right? If I am taking any compound that is less than 350 mg, still it is fatal to me, then these type of compounds are super toxic compound. And usual fatal dose means, it does not mean that all person will die. Let's take, let's understand from another route. If I have given this 350 mg of any compound, any poison compound to 10 people. Out of that 10 people, at least 5 will die. Means 50% of population. How much? 50% of population. Out of 10, 5 are getting fatal effect. Means then we will say it as a usual fatal dose. These are very super toxic compound. Then our second category we will see 5 to 50 mg. 5 to 50 mg. So one is less than 5 mg. That may be 1 mg, 2 mg, 3 mg or 4 mg. Then 5 mg to 50 mg, it is called extremely toxic. Now, if I have to calculate it according to my body weight, then less than 3.5 gram. If I am taking some medicine at the dose less than 3.5 gram, right, then it is going to be fatal for me. Or if it is taken by 10 people, then out of that 5 people will die. So such compound will come under the category of extremely toxic compound. Then similarly, the concentration get dilutes, similarly the ratings get decreased. If some compounds are taken at the concentration of 51 to 500 mg per kg, then these compounds are categorized as very toxic compound, right? Very toxic compound. Then similarly 501 mg to 5 gram per kg, then these are moderately toxic. 5 gram, if I will calculate in my body weight, then I have to take them in very large dose, around 35 gram. Right? Not 35 also. This is 350 gram. If I have to take something in 350 gram to get fatality effect, then those are known as moderately toxic substance. Then the another category is 5.1 gram onwards up to 15 gram. So where I need to take around 1 kg or 1.2 kg to get fatality, then it is very less toxic. Yeah, but toxic. It is having harmful effect in our body. But taking 1 kg poison, it's little impractical, right? But yes, we can categorize them as a slightly toxic poisons. Then at last, we have to take something more than 15 gram per kg is practically non-toxic. Means we have to take in a kg to get the toxic effect. Then it's almost practically non-toxic only, right? So this is a concept of toxicity rating, which is again very, very important from exam point of view. All of you should remember this particular toxicity rating chart. This is very, very important from exam point of view. This can come in 2 marks question, and very frequently it is coming in 2 marks question. We need to be very careful on it, right? So moving ahead, I'll just go to the another few concept, then we will end today's class. Now there are something called poison severity score. Okay, so how we are going to score the poison? So those scales are known as poisoning severity score. Again, this topic is very, very important for 2 marks point of view in your final examination or in your sessional or internal examination. So we are going to discuss about very commonly used severity scale. We are having a lot of scale, but we are not going to break our head in all those scales. We are going to discuss about European Association of Clinical Poison Center, where they categorize the poison into the severity of poison into 4 different classes. One is the none. None का मतलब क्या होता है? Which means कि there are minimal signs and symptoms, or sometimes there may be no signs and symptoms. Yes, but there is a history that person has been exposed to the toxins. So that type of condition is called none condition or 0 score. Means practically he is not having any signs and symptom. Then in 1 score or minor condition, the symptoms are very mild. Symptoms are very mild. बहुत कम symptoms है, and transient or spontaneous resolve. Some symptoms appeared but without doing any intervention. After some time, these signs and symptoms automatically got resolved. Right? Such symptoms are such condition is known as minor severity condition. Then similarly, our 2 rating, that is moderate, means these symptoms will come and these symptoms will persist. They will not resolve spontaneously. transiently, these symptoms will not resolve, then we will tell them as a moderate severity. And at last we are having the severe class, where the condition is life threatening. We need to have a immediate intervention. We need to have a clinical intervention. Once we are not able to give them clinical intervention, person may lose their life. So this is extremely important, right? Everyone is important, but we have to have a more attention in the severe condition, right? So I hope this concept is clear, right? If you are having any doubt on this, you can write back in comments so that we can clear all these doubts in some other sessions. Now, some other important concept per exam from 2 marks point of view, that is poisoning presentations. Some terminologies we are going to discuss here. So these are again very, very important from exam point of view in your sessional and your final examination. So we need to be aware of that. Wherever I am keeping these star marks, you have to understand these are important from exam point of view. Now here our first category is fulminant. So let me make it very clear. Fulminant means, a massive exposure to a massive dose. Suddenly there is exposure of very large dose and person will suddenly get collapse, and sometime it will lead to the death. We will not understand also what happened, very prompt action. Here the duration is very, very short. Duration is very, very short because dose is very, very high. I am not talking about duration of contact of drug. The contact of toxins or drug or any other compounds may be high, but the clinical course is very short. Clinical course is very short. Such condition is known as fulminant condition. What is this condition? Fulminant condition. Then we will be seeing about the acute poisoning. In acute poisoning, the poison or toxins, may be exposed in a single large dose or in a multiple small dose, but or the multiple dose also may be large dose, not an issue, but the exposure duration is very short and the clinical features will be abrupt, right? For example, morning I just exposed to 5 gram of paracetamol, or 3 gram at morning, 2 gram at 8 o'clock, or after 1 hour again I got exposed to that within short period of time, within some hours or within some minutes. This is called short period of time. This is called acute, right? So all these cases will end up in the emergency department because there is a large dose exposure leading to the acute condition which will end up the person in the emergency, which means we need emergency attention or emergency intervention. So all those acute poisoning what we have discussed in the syllabus, we are going to discuss in the same phenomena, right? And the another third category is the chronic category. So in chronic, now you all have studied in pharmacology also, key difference between acute and chronic. Chronic means having longer history. This history is very long. Exposure is very chronic, right? This is all related to the exposure. This is relation with exposure with toxins. Exposure with toxins. Now here in chronic, the arrival of symptoms will be in the insidious manner. Insidious matlab slowly, धीरे धीरे करके symptoms बढ़ेंगे. And generally the dose will be small but repetitive. Doses will be small but repetitive over the period of time. Here, what is important? These doses are repetitive in nature, right? Again and again, we are exposed to the same toxic compounds. Then subacute, it is a mixture of acute and chronic. If there is a acute or chronic, let's say example, acute means some hour, chronic means some days, then subacute sometime maybe in some hours or sometime maybe in a day also, which is neither the acute nor the chronic. Hope you understand this concept. Again, mark it for exam point of view, very, very important for 2 marks purpose, right? Then our another important concept in the feature of poisoning is the non-specific features during presentation in the hospital. Means not only we will discuss about fulminancy, acute, chronic or subacute, how this person is reaching to hospital. Those things we are going to discuss here. So sometimes person may be unconscious or his consciousness will be at a compromised level. He is not oriented properly. That might be a situation. Person will generally end up in emergency department. Sometimes the person will have respiratory or cardiovascular depression. This CB is nothing but cardiovascular depression. Vascular depression. So again, this is a medical emergency, require prompt intervention. Sometimes the person may come in the dehydration condition, where this dehydration condition is generally due to the vomiting and diarrhea. This is repetitive vomiting and diarrhea will lead to the condition of dehydration. Then similarly, sometimes they will come with the hypothermia, right? And how to manage them, what is hypothermia and all these things we are again going to discuss in the supportive management. Generally, body temperature falls below 94 degree Fahrenheit. In some textbook, they will even say 92 degree Fahrenheit also. Then this condition is known as hypothermia. We need to warm them up. Then similarly, the another condition may be convulsions. Convulsions is nothing but the uncontrolled jerky movement. So here, the skeletal muscle will have the jerky movement. This condition is known as convulsions. Then similarly, another symptom is the cardiac arrhythmia. It's like abnormal cardiac rhythm. So this condition is known as cardiac arrhythmia. So now if person comes in this particular condition, what we will understand means the condition is very serious. We need prompt medical attention. What we need? We need prompt medical attention. So this is a concept of features in the thing. Again, this can be important for 2 marks, right? So be careful and remember this concept. Now we are going to see some other important concepts. Again, these concepts we are going to see again and again in the upcoming classes. But with this page we are going to conclude today's class. So I just request you to stay attentive for 5 to 10 more minutes. Now here, how these toxins are going to enter in our body, this is basically, it depends on exposure. How it depends? Exposure. Which organ or which route is exposed to the toxins. So again, it determines what type of toxicity will be there and what will be the severity of toxicity. Right? For example, if there is ocular involvement, means some poison or toxin substances will reach to the ocular region, during exposure, during route also, or sometime from the systemic circulation also. Then what type of symptoms we can expect? There is a change in pupil. In the upcoming classes we will be very master in that, but now it may be little difficult because we are dealing it for first time. First is meiosis condition. What is this meiosis? Meiosis, the pupil will get constricted. Pupil will get constricted. Let's say this is a eye. Okay, this is a eyeball. Here this is a iris. This layer, colorful layer is called iris. Yeah, iris. Then this, the hollow portion from where light will enter into our eye, this is called pupil. Okay, this pupil will get constricted. It will get small. That condition is known as meiosis. If this pupil will dilate, then this is called mydriasis. This is called mydriasis. And generally the normal size of pupil is 3.4. So let's say if the pupil is 1.5 mm, then it is meiosis. Let's say if it is 6 mm, then it is mydriasis. So we have to remember that. Some other ocular manifestation can be nystagmus. Nystagmus क्या होता है? In the eye, if this is the eyeball, this eyeball shakes. ये हिलना चालू होता है. Then this condition is known as nystagmus. This condition is called nystagmus. Diplopia, a person will have double vision. Means if I am one teacher, he will able to see me as a two teacher. Diplopia means the image will be doubled. So it is common in barbiturate, ethanol and opiate poisoning. Similarly, mydriasis I have discussed. This mydriasis generally occur due to the enhanced sympathetic stimulation, or if the acetylcholine is reduced in our body. In the upcoming classes we will see all these conditions. If the sympathetic stimulation is there or acetylcholine level is decreased or its action is decreased, then there is a dilatation of pupil, that is called mydriasis. Similarly, meiosis is nothing but the constriction if acetylcholine is increased or there is a decrease in the sympathetic stimulation. here it is increasing, here it is decreasing, here it is decreasing, here it is increasing. Then the another consequence is blurred vision. धुंधला दिखना चालू होता है, there is blurring of vision. Then altered color perception, our eyes are not able to perceive the particular air, and in the worst condition there will be optic neuritis, and in some poisoning conditions it may even lead to the neuronal damage and the permanent blindness. Some examples like methanol poisoning, we will discuss in detail in the methanol poisoning, which will permanently blind our eyes. Similarly, there is a olfactory involvement, means based on the odors we can say that there is a change in odor, lack of odor, or the odor is increasing. Odor means खुशबू या बदबू. During COVID we might have heard कि there is anosmia, कि हमको लोगों को smell नहीं हो रहा है. Then dermal exposure, once the skin is exposed, then there may be dry skin may be hot, then there may be excessive sweating. This is called diaphoresis or perspiration. Then there may be color change in our skin. We may have blisters, papules, macules, right? Everything we are going to discuss. Then there might be flushing. This is actually due to the increased blood circulation. And sometimes needle mark, if there is a illicit drug or drug dependency, in that cases we can see the needle mark, and sometimes there is a dark pigmentation as a side effect of drug. Basic example is vitamin A. If we will take vitamin A in excess, there will be dark pigmentation. So all those things will be the consequences of dermal involvement. And in the fourth, in oral we will have several manifestations like glossitis is an inflammation of tongue. Glossitis बोले तो inflammation of tongue. Stomatitis is inflammation of mouth. Gingivitis is inflammation of gum. And dental discoloration may present if there is a oral consumption or oral exposure of poison or drug. Now, what we need to important, what is the take of this particular class is toxicity largely depend on dose and duration of contact. This we have to remember throughout our life. What is the dose of exposure and for how long period it got exposed, that is going to decide what type of toxicity is going to happen and what will be the prognosis. Prognosis का मतलब होता है clinical outcome. Clinical outcome. Right? So this was a basic concept, background of clinical toxicology subject. So let me remind it. In today's class, we have discussed what is the syllabus framed by Pharmacy Council of India. So we have taken reference of Pharm Regulation 2008 and we have discussed the several chapters, and we came to know that total we are having 13 chapters. Out of that 1, 2, 3, 4 and 5 are integrated chapters, and 7 is very important from exam point of view, 8 also very important from exam point of view, right? 9, 10, 11, 12 very important for our understanding purpose, and 13 as we all are in the eligible age, our age is something like just we cross adolescency, or right now also we are in adolescency. So again this substance abuse is of great interest for us, and we are going to see all these things in detail, right? And my dear friends and my dear students, please let me know the feedback of today's class. What are the easy things, what are the good things, and what are the things that I can improve, or what you require for exam point of view, for learning point of view. All those things we can discuss. So do not forget to drop your suggestions, your feedback in the comment section, so that I will work on that and we can improve the things. And please like the channel for the upcoming classes. Thank you.